If you are ready to start volunteering at Brigid's Path, or you're already a valued volunteer who has been away for a while, we thought you might feel more comfortable stepping back into this vital role after a brief reorientation. This video is intended to reinforce information shared during training and to provide some practical tips to help you comfortably and confidently step into your cuddler role. The security guard will always let you in and out of the building. The guard will also provide you with your personal security badge when you arrive for your first cuddling shift. It will give you access to certain secured areas within the facility. You will always wear the badge when on duty and take it with you when you leave. Let the guard know if you will need a locker key for your personal items, including your cell phone. When we're observing COVID-19 safeguards, you'll need to stop by the clinic next to the security office to wash your hands and to take a new disposable face mask. During COVID-19 protocol, face masks must be worn properly at all times in the nurseries. The volunteer lockers are located in the staff kitchen. Please place all personal items in your locker. This includes cell phones, as cell phones are not allowed in the nurseries, with the exception of nurses and PCAs who need them for some work-related purposes. Once your personal items are safely secured in a staff kitchen locker, pick out a teal smock to wear throughout your shift. Sizes range from extra small to 5XL. Upon the end of your shift, please check the pockets of your smock and zip or snap it before placing it in the laundry basket. In terms of attire, there are no special requirements other than closed-toed shoes. We suggest that you dress comfortably in casual, conservative clothing. We also remind volunteers not to wear scented body products when coming in to cuddle, as strong scents can trigger distress in some babies. Nurseries are differentiated by the color of the wall opposite the main door. Purple, which is on the left, and yellow is on the right at the rear of the hall. When both nursery suites are in use, you can check with each to see where you might be needed. Simply walk in, greet the nurse and the PCA on duty, and introduce yourself. Add your name to the dry erase board so the staff and the families can correctly address you. Ask the staff where you are needed, and remember that you may not always be in the same nursery. Please be sure to wash your hands at the sink by the main door in the nursery before cuddling a baby, as well as between babies. At a minimum, if things are hectic, be sure to use hand sanitizer when cuddling different babies. And remember, no kissing babies. When a baby is in their private room alone, they will always be attached to a monitor. Detach the wire connecting the baby to the monitor when removing them from their room. Likewise, you'll need to reattach the wire when you place the sleeping baby in their room alone. If the baby wakes up before completing a nap, you do not necessarily have to detach the wire in order to pick the baby up to comfort and try to get him or her back to sleep. You can always ask the nurse or the PCA to demonstrate this procedure when you arrive for your first cuddle shift. Babies are never to be taken outside the nursery suite and should be cuddled in their private rooms unless the clinical staff indicates otherwise. Cuddling in a baby's private room is particularly important when the baby is actively recovering and may be overly sensitive to stimulation or is having difficulty resting or sleeping. Babies should also be cuddled in their private rooms anytime meetings and/or private conversations among the BP staff and families are taking place in the nursery common area. If a baby seems to be inconsolable and none of your attempts to provide comfort are working, you can always ask the nurse or PCA if there is any particular technique to which the baby best responds, or if perhaps the baby needs fed or a diaper change. As a reminder, a volunteer's role is to cuddle and comfort a baby, as well as feed a baby after completing special bottle feeding training. The clinical staff and/or family members are responsible for all other aspects of care, such as bathing, diapering, dressing, etc. Please be prepared to be flexible and willing to help in whatever capacity is needed. There will be times when you need to cuddle, comfort, or entertain a baby for the entire shift. There may be other times when babies are sleeping or being cared for by the clinical staff or families. When this is the case, there will most always be opportunities to catch up on laundry or disinfect door handles, counters, etc. Be aware, though, that a baby's needs may change at a moment's notice, and you will want to stay within earshot of the nurseries. Always, always wear protective disposable gloves when handling soiled laundry items and/or when cleaning. Collect soiled nursery items and/or family bathroom linens and take to the laundry room. Remember, we only wash full loads of laundry. Each nursery's laundry is processed separately, yellow and purple. Laundry instructions are posted on the laundry room wall above the folding counter, but a few of the laundry basics to remember are: load each soiled item separately and examine for stains. Pre-treat with stain remover as needed. Check for heavily soiled items, which will be contained in separate plastic bags. Pre-treat these items in the laundry room's big white basin to remove the solids and the heavy stains prior to placing in the washer. Use magnets on the washers and dryers to help keep track of each nursery's laundry items. Fold and place clean nursery items in a white basket and return to the proper nursery. There may be times when it is not in the best interest of our babies or the volunteer to report for cuddling duty. The health and safety of both is a prime concern. If you should experience illness, injury, surgery, or anything that would impact mobility or safety while volunteering at Brigid's Path, please know that you can call off without any worry of ramification. You can cancel any scheduled shifts in your portal, and for any questions, contact Terry Stuckey.